All right. Well, thank you everyone for sticking with us throughout the day. I hope you found all of this content useful. We're going to end today with a session all around restraint and isolation and what our law requires and what is required for reporting. I, again, am April Ebinger. I'm the Director of Psychological and Behavioral Services for the Tennessee Department of Education and oversee a lot of the work around restraint and isolation. And we do monthly data checks around restraint and isolation. So you're going to hear me talk a little bit about what that entails and if we reach out to you and whatnot. But as we go through this today, because we typically do this training over the course of about 2 hours, 2.5 hours, I'm going to go pretty fast through this, but feel free, drop any questions into chat as we're going. So what are we going to cover? We're going to cover what SEPSA is, which is the Special Education Behavioral Supports Act. And then we're going to talk about what you're required to do after any incidents of restraint and isolation. So federal law is quite silent on restraint and isolation outside of a provision under Section 504. And it really leaves it up to the states to define and provide the provision of use around restraint and isolation, and then build out what that reporting structure looks like. So here is our statute citation, and then our Tennessee State Board rule around reporting. And then we're going to dig into all of these requirements and specifically what is required under Tennessee Code annotated momentarily. But where Section 504 speaks to the use of restraint or seclusion or isolation is really around that discriminatory use, right? We're not going to, implement restraints or isolation in a discriminatory manner against students with disabilities. In fact, there was that 2016 Dear Colleague letter that really highlighted that the over-reliance on restraint and isolation could essentially be impeding your ability to provide FAPE for a student. So if you are having a lot of students or one student who has significant number of restraints and isolations, one, we would really encourage you to reach out to me, our offices, or our technical assistance network. Our colleagues at Triad will love to come in and partner with you. And more than likely, if you do have significant numbers of restraint and isolation, you will be hearing from us. So again, as I alluded to, we review these data monthly. And in fact, if you have any students that have a significant number, you and your district admin will be getting an email from us saying, can we please support you? Can we please help you? We want to decrease the reliance on restraint and isolation to the greatest extent possible. I will say that we've made a lot of movement in the state. So from the 21-22 school year, we were sitting at just over 11,000 incidents of restraint and isolation. This past year, the 23-24 school year, we were just over 9,000. And those are individual incidents, which is incredible. But do I think that there's probably some other rationale, other reasons why we've seen a decrease? Sure. I think we're relying a lot on informal removals, the use of suspension expulsion for these students, and educational homebound. And in some cases, those things may be appropriate for educational homebound or suspension expulsion, but we really need to target the use of restraint and isolation. As all of you know, if you've ever had to restrain a child, it is not only traumatic on the child, it's also traumatic on the folks that are having to implement the restraint. And so whatever we can do to reduce the reliance on restraint and isolation is always going to be in our best interest. Keep in mind that parents can file Office of Civil Rights complaints around in the provision of use of restraint and isolation. Just because they do this, you may have to go into some really high stakes resolution agreements, especially if you were deemed to have violated the student's civil rights. So any of those emails that we send out to districts to say, hey, we're concerned, please take those seriously and then allow us to assist you, whether that's partnering with Triad or conducting some additional training with your district. Anytime that we are reaching out, it's because we're concerned and we hope that you'll take those concerns as seriously as we do. So the Special Education Behavioral Supports Act, you know, administrators, we love our acronyms in special education. We call it lovingly SEPSA. What does it say? It essentially says that we're going to ensure that every child with a disability is free from unreasonable, unsafe, and unwarranted uses of restraint and isolation, which we'll talk about in a second. We want to strongly encourage the uses of positive behavioral supports and interventions, and we want to make sure that staff are properly trained in order to reduce the dependence on restraint and isolation practices, and then ensure that they're properly trained to protect any of the folks that are involved from unnecessary harm. Anytime we're having to put a child in a physical holding restraint, there is an inherent risk, not only a risk to the child, but also a risk to the folks that are implementing the restraint. And so we want to make sure that folks are properly trained to implement those restraints in a manner that will keep, again, the student safe and the faculty members safe. When is it allowed? Only in emergency situations. And we know that mechanical and chemical restraint are never allowed, but what constitutes an emergency situation? It is that serious threat and risk of harm to self or others. And so often when we're reviewing these restraint and isolation reports, and recently we saw one where it was a 7-year-old was attempting to kick the principal. Now, folks, anything around restraint and isolation is going to be very fact and context specific. So in this case, a 7-year-old that was attempting to kick the principal, is that risk of serious harm to self or others? I don't know. More than likely, probably not. But let's say the context in this case is that the principal was an 85-year-old female that had pre-existing conditions that if she was kicked and pushed off balance, she would more than likely fall and hurt herself significantly. If you don't give us that context within the restraint and isolation reports, we cannot infer that. You have to give us that information, right? You have to tell us why it was a serious threat of harm to self or others. And often what we see in the reports is very simply physical aggression. What does that mean? Were they coming after you with a closed fist? What was the size differential? How did you try to de-escalate, put time and space between you? How did you try to give them choices, alternatives? Tell us all those things that you did within the restraint report. And then if you had to then rely on that restraint or that isolation, tell us why it posed a serious threat of harm to yourself or others. I cannot encourage you strongly enough to give us that context. I will say, as we're going through this training, one of the not so great parts of my job is that if there's ever a question or a complaint filed to the state board for a licensed faculty member in the state of Tennessee, they will typically loop in our offices and then sometimes me to review any type of information to give some feedback on was it an appropriate restraint. Was it done and reported in a manner that it should have been? All of these pieces. And so in my 4 years now at the department, I've had to do this 4 times. And it's not a great place to be in when you're looking at this evidence for faculty members who typically, by and large, are going to have the best interests of students at their front of mind. But you have to report these cases, and you need to make sure that you give us enough information that we can easily discern, yes, it was an emergency situation and they needed to put the child in a restraint or isolation to keep the child or other people safe. When is it prohibited? A non-emergency situation as a means of coercion, punishment, convenience, retaliation. I feel like this language kind of echoes maybe some of Section 504, those discriminatory practices or uses of restraint and isolation. And then to protect property. Folks, I know it's never fun to watch a child destroy a classroom because I know that your superintendent is probably not standing outside your school building ready to replace all those computers that were just destroyed. But you cannot restrain or isolate due to property being destroyed. Your staff needs to be trained in a manner that potentially they are able to navigate the classroom and they're able to put themselves in a position where they can pick up things that are or maybe valuable that they need to remove or remove things that are potentially dangerous. But again, isn't this very fact specific? If I take a computer and lift it up and crash it on the floor, it's probably not going to be an instance where it's a serious threat of harm to self or others. But if I pick up that computer and I come at the paraprofessional, then maybe the shift of that context has changed and maybe a restraint or isolation in that situation is necessary. But to protect property alone would not be a need to to restrain or isolate. When else is it prohibited? Removing or disabling any equipment, device that a student requires. I highlight this because I've seen this even in my own practice previously as a school psychologist. We had a student who had a augmentative communication device. And often when he was dysregulated, they would call me to come down and help de-escalate. So they called me one afternoon and I went to the gym and I walked in and I already kind of knew what I was going to do. I knew my first prompt and I had it all planned out, and I get in there and I'm kind of taken aback because the student didn't have his talker with him. Well, lo and behold, we found out that the PE teacher took the talker away from the child, put it on the bleachers each day, and said, no, you can't use that. That's a crutch. According to SEPSA, you cannot do that. And I also know in some of our special education classrooms, maybe even some of our general education classrooms, if they have communication devices and maybe they push the same button over and over and over and over and over and over again, I want, there is that desire perhaps to say, oh my goodness, we're going to disable this. You cannot remove or disable. The same would be true if a child had a wheelchair that they required to navigate the school building, and you were able to lock them into place where they could not move and navigate independently. We cannot remove or disable any equipment or device that a child requires. We also must keep in mind that any life-threatening restraint that would restrict that flow of air to any person's lungs should be very strongly caution prohibited. I don't know if I typically, when we're doing this face-to-face, will say, does anybody use the prone supine position? So face down, face up positions for restraint. I strongly discourage the use of those. One, they look awful on camera, but they're incredibly dangerous for the student that is involved with them. So strongly encourage you to make sure as you're implementing any type of restraint or isolation, you have observers that are monitoring that student's status, that are able to determine that the child is breathing, all of those pieces. One of the big stories I always tell is this was out of a private residential facility in East Tennessee about 10, 12 years ago. The only reason I knew of this situation is I was attending a training around how to decrease the reliance on restraint isolation in clinical settings. And the head of psychiatry at this hospital that was overseeing this residential was leading the training. And he actually showed the video, and if you Google it, you can still find it. So about 10, 12 years ago, a student in a residential facility for severe behavioral disorders could be seen walking into the cafeteria. He was holding his tray. He was coming into his cafeteria. It looked just like any other high school cafeteria, right? They had the long rectangular tables with the circular chairs that attached underneath. Very few students were seen on the camera. There was no audio, by the way, just this video. He comes into the table, sits down in the middle of this long rectangular table, and about 35 seconds in, and by the way, you could see just by his body posturing that he was not having a great day. So he sits down, and within like 35 seconds of the video, he takes about half of his sandwich and he throws it. So here comes the male tech over to him and gets right up next to him and hovers over him. Well, folks, what is he doing? The first step of de-escalation is to give space. And often when a student has any type of misconduct, it's to get in their face. That is the exact opposite of what we would teach across any de-escalation protocol, is to give space. You certainly can initiate contact, but to not get that close. So he starts to hover, right? And what it typically is intended is to intimidate, right? Well, you can see that the tech is talking at this student. And then at some point, he takes another half of his sandwich and he throws it away from the other tech. Well, here comes a second male tech onto the other side. He puts his one leg up onto the round chair next to him. And now he leans in. So you have these two big brooding men over this student. And then across from him, here comes the director of this program, a little short woman from who oversees the program. She comes over, and I know you can't see me. She puts her hands on her table and she leans in. So he's got three adults all around him and she's just barking at him, right? And you can see her head kind of shifting and she's just yelling at him. The student starts to stand. He doesn't even get fully erect in his body posturing. And the two men take him down into a face down restraint position. By the end of this restraint, the student is dead. Any form of life-threatening restraint, we want to be very, very cautious about. Folks, the child is dead for throwing a sandwich. How does it constitute an emergency situation in that case, right? We have to always remember that we have to weigh the risks and the benefits of implementing a restraint. And there's always inherent risk to implementing a restraint, right? Both for the student and for you, okay? And we have to navigate those, the risks of doing something versus the risks of doing nothing in those moments. But we have to ensure that it is an emergency situation before we implement. So we know there's 3 types of restraint. We can do physical holding. We cannot do chemical or mechanical. So physical holding, the use of your body to restrict freedom of movement or normal access, except for we get these questions all the time, and that's why I carve these out and how they read in steps. So you absolutely can calm and comfort. Can I give a child a hug? If the student wants to sit in my lap, crisscross applesauce, and have my hands wrapped around them when we're doing morning meeting, absolutely. Now, context and fact specific. If we're doing crisscross applesauce, my hands are around, and they start to squirm to get out, we're going to release, right? But you absolutely can calm and comfort your students. Can you, hold their hand and walk them down the hallway? Absolutely. Can you have your hands on their shoulders and walking them down the hallway? Absolutely. But context and facts matter here. So let's say in the absence of an emergency, you can do that, but then the child starts to pull back and they're going to make a dash for the exterior door. Now, if they're going to start to pull back, we're going to gently perhaps release unless there is an emergency and we do need to put them into a restraint. You absolutely can assist the student in completing a task. You can do some hand under hand. You can help manipulate blocks or get a writing utensil to complete an assignment. Keep in mind, resistance, minimal intensity or duration. Minimal intensity or duration. Physically redirecting, maybe you have to reposition their body and orient them to you, right? Maybe you're having to do a little bit of that to get them where you need them to be. When we're doing this in person, I always show what not to do in this case, but we're not whipping kids around. We're not physically using our size to manipulate their bodies in a means that would be punitive, coercive, or retaliatory, but we're redirecting them in order to get them to help us complete that task, complete maybe some therapy, whatever that looks like. Keep in mind, it also notes minimal intensity or duration. And then one of the biggest questions we always get is, can I block an exit? Absolutely, you can block an exit, but it's very fact specific, right? And so if you're blocking an exit and let's say the student starts to run at you, now you're going to have to weigh the pros and cons here. If you're blocking an exterior door, and the buses are dismissing behind you and they're going to run into that traffic, maybe you're going to have to engage in a restraint. But maybe the exterior door leads to an outside field that's completely fenced. There's no risk of that child being able to get over that fence, and you can safely allow them to exit that door. Please note that you can absolutely block their exit. What I would really strongly encourage you not to do, we do not put furniture in front of exits. We do not breach fire codes to block exits. We've heard a lot recently around the use of these mechanisms that attach to the top of doors that only an adult can unhook to open the door. God forbid there's a medical emergency and the students can't get out of the room because the adult is incapacitated. Remember, we must adhere to all fire codes for restraint and isolation, but we do not block doors. If we need to look at your environment in your classroom to set up natural barriers, right? If you do have a student who likes to elope, maybe using your desks and your tables and your bookshelves in such a manner that you would have this natural kind of maze to get to that exterior interior door, we certainly can do that as long as we're adhering to those required fire codes, okay? Mechanical restraint. This is an application of any device, material, equipment adjacent or attached to their body, okay? And the 2 prongs that we always look at is the student cannot easily remove and restricts the freedom of movement or normal access, okay? So when we think about mechanical restraint, an easy one for us to think of are handcuffs, zip ties, or duct tape. Anything like that we're attaching to their body where they cannot easily remove it and restricts their freedom would be considered a mechanical restraint. restraint, it would not be allowable in the state of Tennessee. Now, I mentioned earlier that a part of my job is assisting the state board when there is a complaint filed against improper use of restraint or isolation. I'll give you an example around mechanical restraint now. This was a couple years ago that this occurred. This was in a self-contained behavioral classroom, and this school actually had both video and audio. So it was a middle school self-contained behavioral classroom. In the video, when it starts, you can see about 4 students in the classroom, and then there was 1 female teacher and 1 female paraprofessional. Well, this child in question was a female. She didn't have a fantastic home life, and she didn't typically transition home well in the afternoons, and especially on Fridays. She did not transition well home on Fridays. And in fact, she would put these things into place that would almost make it near impossible for her to transition home. The doctors called them pseudo seizures. And for all intents and purposes, folks, on camera, it looked like a seizure. Okay. So when she was prompted to start to pack up in the afternoons, she would typically have these seizures. So much so that they had a plan of care through an IHP that said anytime she started to have one of these, the first person they would call would be the school nurse. Well, on the video, it was a Friday afternoon, and the teacher starts to give commands to start to pack up. We're headed to the bus, and this student walks over to the corner of the classroom, sits down on a beanbag, and starts to have one of these pseudo seizures. I'm telling you, folks, it looked just like a seizure. The teacher walks over, and because there's audio, we can clearly hear that the teacher says, "I don't have time for this today. We're not doing this, right? I have somewhere to be." She prompts the paraprofessional to go get a wheelchair. They bring the wheelchair back. They attempt to lift her into this wheelchair several times and drop her. Okay. By the time they get her into this wheelchair, the student realizes, "Oh, you're going to take me to the bus," where she does not want to go, and she starts to fight back. This goes on for roughly 35 some minutes. Okay. In the meanwhile, the mother has arrived at the school building. Okay. And then at some point during this, the lead principal pops her head into the classroom, sees that they're holding her in the wheelchair, okay? Sees that they're holding her in the wheelchair and leaves. She says nothing, she does nothing, okay? At some point, the child calms down, starts to cry. They're able to let her go. She's still sitting in this wheelchair, okay? And mind you, think of a mechanical restraint. It's a mechanical device, material, equipment. Could she easily remove and get out of this wheelchair because they're holding her into it, right? No. So principal comes in, sees her, whatever. At some point, once she calms down, the teacher walks over, and she at some point got a phone call saying the mother was at the school. And the teacher clearly can be heard saying, "We don't have to tell her." They never reported any of this. So by the time the child gets home, she's covered in bruises from being dropped and held down for so long in this chair. The parent obviously reached out to their new attorney, as well as making a complaint to DCS. When the State Board of Education was brought in was after the prompting of the DCS report around child abuse. And so the state board is reviewing licenses for both the teacher and the principal. This is where administrators, I cannot stress strongly enough. Have you been trained in your restraint and isolation policies and practices? Have you gone through that training? Whatever program you subscribe to, if you haven't been, I would strongly encourage you to go through that. Because why? Because you are the LEA of that building. And if you pop your head in and you see something that doesn't align to your curriculum, you can immediately step in and intervene, right? And that's how this principal argued it. It was like, "I wasn't trained." You have to be trained. I absolutely would want every single administrator, assistant administrator in your buildings to be trained on your protocol. So you know that if a teacher is going rogue and they're not following the curriculum, or if it is a standing only position type of restraint that they're taught and somehow they end up on the floor, somebody can intervene, not only on the behalf of the student, but on your behalf. Okay, so please make sure that you're trained and that you know what is allowable and not allowable within your training program. You'll notice here under mechanical restraint, there are some carve outs here. Adaptive support is the big one we hear. Have you guys ever seen those Rifton chairs? They're essentially these standing, see, because I can't show you because you can't see my body. Students are placed into these chairs and they are strapped in from their legs to their up to their arms, and there's typically a tray in the front. It essentially is designed to build those core muscles, right? And it's used for PT and OT. We would strongly encourage you, because they are considered adaptive support, to have provision of use in the IEP, as well as maximum time limits for a Rifton chair. We don't want kids sitting in them all day, okay? Have you ever seen those cube chairs? Often I see them in preschool classrooms where there's sides that come up on the chair and then there is a tray that locks into place on top. Go back and look at our criteria. If the student cannot easily remove it and restricts freedom of movement, it's a mechanical restraint. So be very cautious about some of the typical chairs that you're using across your school building. Somebody asked me this past week in one of the trainings, and she said, April, are we allowed to use seatbelts? And I was like, sure, if it's documented in the student's IEP, you can use a seatbelt. But she said, no, in the classroom. And I never thought of that before. I didn't realize some of our chairs had seatbelts, but keep in mind that mechanical restraints allow seatbelts, right? But it does specifically limit it to during transit on the bus or vehicle. I would be very cautious about utilizing a seatbelt in the classroom, because again, if we're talking about convenience and not utilizing restraints for convenience to keep kids in a certain area, that's probably teetering on that line. And so also remembering that if you have the provision of use for the seatbelt in the IEP, we're not keeping that device on them all day. We had this pop up recently where a child had it in the IEP to have a 5-point harness. You know, those come over your shoulders, come around your waist, and there's a little tail on the end that hooks in the butt, not in the butt, on the bus. And the classroom teacher was keeping the 5-point harness on the student all day long and using it as a mechanism for convenience, because she could hold on to that little hangy piece on the back side of the harness and pull and push as she needed to. We're not using devices in that manner. If you ever have an issue with the child who is eloping, who is leaving their designated area, who is a danger to themselves or others, I would always encourage you, again, to reach out to us, Triad, to work with their teams of BCBAs and RBTs to come in and help support that child, okay? Chemical restraints, this is any medication that is prescribed to restrict a student's freedom of movement. You typically see this, I feel like, on TV, where there is a patient in a hospital who's maybe having a moment of outburst, and then they come over and they give the person some type of medication. We are not giving any child any type of medication, anything that could potentially harm them in any manner. Okay, so keep this in mind. This could include over-the-counter medications. This could include anything that you would give a child. So isolation. So two-pronged approach here. They must be alone and prevented from leaving. So let's say Johnny is having a huge outburst in the classroom. You do a clear classroom and it's just you and Johnny in the room. Is that an isolation? No, because they're not alone. They must be both alone from students and other faculty and prevented from leaving. Now, if you step outside that door and you're outside the door frame, maybe the door is not even shut, right? But you are outside the door frame, they're alone in the room, and you're preventing them from leaving. Now it is an isolation, okay? Now it is an isolation. So very much fact specific, but they must be alone and physically prevented from leaving. Somebody said this past week that they asked, well, can I break up a fight? There is some language in the statute that absolutely can break up the fight, but what happens if you break up the fight with two students with disabilities and you push them into different classrooms, and then you're holding the door closed to make sure that they don't get out? It may not be a restraint in that moment because you're allowed to break up the fight, but it may turn into an isolation if they are alone in that room and then prevented from leaving. So making sure your teams understand what would and would not constitute prior to reporting. Keep in mind too, we've gotten a huge influx of reports coming for general education students. We certainly advocate for you guys to document that in some way, but the only reports that are coming to TM Pulse for us are those that are for IDEA eligible students only. So Section 504 and general education students, you may need to document those elsewhere, but please do not input those into TM Pulse, okay? Timeouts don't include are not included here. You absolutely can use timeout as a behavioral management technique. I'm not sure if you would ever do that nowadays, but you certainly can use timeout. Keep in mind that anything can turn into an isolation space. Some of you are saying, April, we don't have isolation spaces. And not that isolation spaces are right or wrong. It's certainly your discretion, but you have to understand that any classroom, any room, the library, the playground, the cafeteria, the auditorium, anything can turn into an isolation space if the child is alone and prevented from leaving. Okay, so let's look at this case. I know Taylor was, I think actually Tate was alluding to this case earlier, and so you may get some additional facts here. But part of this case was that this child was in the gym area and they used the gym mats to circle the child. And they said, and the district argued, well, it's not an isolation because we are in the space in the gym with the student, right? And the judge essentially said, no, you have contained that child around the gym mats in a manner that created an isolation space, and you prevented the child from leaving. Also, subsequently, you could not be in direct visual contact with the student at all times because they were behind this mat or these mats. So anything can turn into an isolation space. I just want you to reiterate that. It could be, somebody asked me this past week, April, we have a sensory room. They absolutely can use the sensory room. So if they go into the sensory room, right, and they come out, well, they're not prevented from leaving. So it's not an isolation. But let's say they go into the sensory room. Now there's some type of emergency situation that presents itself, and you're going to prevent them from leaving. It can turn into an isolation space, even though that's not what it was intended for. Okay? So who may restrain or isolate? Well, technically anyone. We really I think less than 4% of our data indicates that uncertified people are restraining or isolating because there is a greater risk of injury for those people that are implementing restraints or isolations that have not been trained. But if, let's say, a child's running out the front of the school building and there's a main highway there and there is an untrained person at the end of that hallway, I hope that they're going to do something to try to protect that child in that moment if somebody who is trained is not immediately available. All right. I would always encourage principals on this call that you guys have crisis teams on every hallway. Restraint and isolation should not just be a special education faculty member's job. It should be jobs of your crisis teams that you have across your buildings so that at any point, if we need to have somebody who is certified to keep folks safe, that you will have access to those personnel. I'm going to give you just a minute to read this scenario, and then I want you to tell me at the end of this, what should we report, if anything? All right. The student runs out of the room, goes to the behavioral classroom, slams the isolation room shut door, and cries. Are we reporting anything? No, right? They were alone, but were they prevented from leaving? They weren't. So it's not an isolation. And in fact, I would probably call this parent and say, hey, I'm really excited to share that we've been practicing these coping strategies. And today, Johnny recognized he was getting overwhelmed. He was able to identify his emotions. He went to his calm down space. He was able to regulate himself in 15 minutes. It was great. Now, the next thing, Mom, that we're going to work on is we're going to work on requesting appropriately, right? We want him to be able to tell us when he needs to use that space as opposed to just running out. But we're so proud of him today. Now, administrators on this call, sometimes if a kid leaves a room without permission, we're immediate to punitively provide a consequence, as opposed to understanding their disability, understanding their BIP, understanding their plan, and saying, this kid is making progress, right? We just have to do a couple other pieces here to get him to appropriately request before he's going to go to that space. But this is what we've been working for, right? This is what we've been working for. And there's nothing to report to the department in this case, okay? Procedurally, this is where we see a big piece of violations across the state with restraint and isolation. It is forgetting when to hold IEP meetings, okay? So there are three carve-out here's, and I thought I had these animated, but I think that my computer was not happy with me the day that I downloaded this. So there's three reasons why you're holding an IEP meeting after the provision of use of restraint and isolation. You must hold that IEP meeting within 10 days if the restraint lasts longer than 5 minutes or the time provided in the IEP. Now, I'm going to say this again because we got a lot of confusion from practitioners across the state. Even if you put in 65 minutes in the IEP, if you exceed 5 minutes, you're having an IEP meeting. We do not recommend putting in the timestamps because it's confusing to parents. So if a child is, let's say, 9 years old and you put in he can be restrained for 15 minutes, but if you restrain for 6, you're having an IEP meeting, okay? Anything that lasts longer than 5 minutes. And your users will see in our TM Pulse system, there's a little flag at the top. When they put in the timestamps, it will say, your restraint lasted longer than 5 minutes. You need to hold an IEP meeting. If they see that, hold an IEP meeting, okay? The other two carve-outs here are if the student doesn't have the provision of use in the IEP, or that the FBA BIP, if you have one, didn't have didn't identify the target behavior as the precipitating behavior that led to the restraint and isolation. Meaning, if the student already did have an FBA BIP, let's say for elopement, and then the child was restrained because of physical aggression, now you're having a meeting. Make sure you're having meetings when you're supposed to have IEP meetings. Isolation is similar within 10 days of the use of isolation if it lasts longer than 1 minute per year of the child's age. If the child's 12, you can isolate for up to 12 minutes. If you isolate for 13 minutes, you're having a meeting. Even if your IEP says that you can isolate for 65 minutes. The key word there is or. If either of these statements are true, you're having an IEP meeting, okay? The same would be true as if the provision of restraint isolation is not in the IEP, or the precipitating behavior for the need for isolation was not reflected in the student's BIP, or the student didn't have a BIP, right? So what are we doing in the IEP meeting? Well, we should be talking about how we're going to reduce the likelihood of having to restrain and isolate in the future. What are we talking about? Maybe we're going to update and modify the BIP. Maybe we're going to get consent for an FBA if we don't already have one. Or maybe we're going to get consent for the FBA to identify new target behaviors. Maybe we're going to talk about the services. If our data is saying, oh goodness, we're having to restrain every time the child is in the hallway or unstructured environments, or when there is an unknown change in the child's day. This is going to help you build in those supports to make sure that the IEP is appropriately matched to reduce the likelihood of having to use restraint or isolation again. Keep in mind that a child must have a documented FBA BIP for the provision of use to be put into the child's IEP. Let's look at this scenario. As you're reading this, there's two slides, and I'm going to go ahead and read it to you because I have to change the next slide to get to the end of the scenario. I want you to count how many reports we have to write. Remember, every individual incident must be reported separately. So let's say I'm doing a two-person standing restraint with the child. We think that the child is ready to be let go. The child looks and appears to be de-escalated. We do a safe release, and then the child escalates and it's a new emergency situation and we hold them back again. Those are two separate reports that must be reported to the department, okay? A student has become highly escalated in the classroom. Student begins throwing chairs around the room. The teacher and the other students in the room, they leave and they do a room clear procedure that has been practiced. While awaiting the arrival of the trained physical holding restraint team, the teacher stands outside the doorway and prevents the student from leaving the room. The physical holding restraint team arrives. They take over for the teacher to ensure the student does not leave the room. After a short time, the student grabs a pencil, tries to stab his own arm. The physical holding restraint team, using an appropriate hold, restrains the student. The student calms down and the team does a support transport hold to move the child to a different classroom. Upon arrival, the student is escorted into the isolation room. The adults are able to let go of the student, and the student stands against the wall, breathing in and out audibly. The student begins to breathe calmer, starts crying, leaves to get a tissue, and returns to the isolation space. How many reports are we doing? When we do this in person, we usually get anywhere between 2 and 5. I would always encourage you, I would rather you over report rather than under report, just procedurally. In this case, I counted 3. The first one is the isolation. The teacher stands outside the doorway and prevents the child from leaving. Number 2 report is that the child attempts to grab a pencil and stab his own arm, and they implement an appropriate hold. Now, I'm going to highlight something here for you before I move on. This scenario says the student calms down. Why, oh, why are we ever putting our hands on kids if they're calm? Okay. If the child is calm, could we, using some appropriate de-escalation communication skills, prompt them to move safely where we need them to go instead of having to do a support transport hold? But because you did a support transport hold, more than likely that is going to be determined to be a restraint and you will need to report it. Okay. Again, if you are not taught transport holds, many of our curriculums don't teach transport holds. I would be very cautious of utilizing those. Anytime we pick up a kid, 1, it doesn't look great on camera, okay? And 2, it's really dangerous. Restraints are all about stability. And as soon as you lift a leg, you lose that stability and you're more likely to hurt yourself and to hurt the student. So if the student is calm, why are we moving them? Let's continue to de-escalate, keep the child safe in that setting, and then we can de-escalate and verbally be able to move them to another space as we need to without having to put our hands on the student. So that would be my 3rd report. And then the last one, they're escorting them into the isolation space, but the child is able to leave. So that child may be alone in the isolation space, but is not prevented from leaving. So I counted 3 reports there. Okay. Some additional reporting requirements as we wrap up here. Keep in mind that you're going to notice the report template is pretty intuitive. I'm going to skip through this real quick to get to to get to actually what it looks like in TM Pulse. So under the student info, there's a restraint isolation tab. You're going to click that. You're going to essentially create incident here. If you have access, you can search all of your incidents in your buildings. You can pull reports for those. You can disaggregate by school, by incident type, from certain date ranges. That's what we do at the State Department. So you certainly can do that as well. But this is where you will go bare minimum to create that. You're going to identify if it's a restraint or isolation. And you're going to make sure as you're starting to complete the demographic information that this is all accurate. We get a lot of errors where somebody will indicate the restraint started at 8:15 a.m. and then ended at 8:16 p.m. Make sure that all the data that you're entering here is accurate. How soon must a parent be notified after a restraint and isolation incident? The same day. So you need to make sure that the principal or principal's designee, you, right, are notifying the parent the same day. If you note it in our report as being after that same day, it will throw an error code to us. And you may not know this, but it counts towards your risk analysis for special education monitoring. So we want these reports to be as accurate as possible, okay? This box under antecedents is going to be your biggest bread and butter here. We need to know why it was an emergency situation. Please give us the context, the situation. A lot of people say, April, you tell us not to give us too much information in your prior written notices, or you tell us to not give too much information in this context. I haven't seen any restraint isolation reports where too much information was given, unless one that I read recently, it was about 3 paragraphs of telling me that they restrained due to property damage, which is not, as I told you, not allowable. So give us that context of what happened before, what happened during, how did you know it was an emergency situation? At the end of it, you're going to tell us, how did you know the student was calm? How could they be released? And all of these questions on the restraint isolation report, these all default to no. So you probably will be hearing from me if you indicate that a student or staff member has died. So make sure that, again, these are all accurate. And then all of these will have additional boxes, text boxes, that will open underneath them that you can write additional information. One of the most important questions on this sheet here is the last one, which says, was the student's condition evaluated by a school nurse, principal, or principal's designee? I would absolutely make sure that you always indicate that somebody has observed and looked at the child and evaluated their condition. I would even tell me who that was in the text box, just in case the child does go home and complains of aches and pains, that you have appropriately identified that here. Isolation report looks very similar. We just added 2 additional questions to adhere to the requirements if you do have an isolation space. And then improving isolation reports, we do have a rubric. This was probably more so for your special education directors to improve the compliance and quality of those isolation reports. We've already talked about this. Who should be trained? Anybody that you feel necessary. Always consult your local board attorney when you're making these decisions. This is another frequently asked question we get is, should I restrain a student who is eloping? Again, fact specific. It just depends. If they're running out and it is a major highway, that's going to be very different than if they're running out and there is a field, or you have a professional who is able to catch up with them. Making sure that you're weighing those risks and benefits right in that moment to determine if it is an appropriate situation. Not every case of elopement should end in a restraint, folks. Often, even when I was still practicing, if we had a kindergartner who would run down the hallway, they would immediately put him into a restraint. I don't think that's always the right answer either. It's going to be very much on a case-by-case basis. We talked about seatbelts. I do want to get to this slide real quick. If you put the provision of use of restraint isolation into the student's IEP, this is the next question I'm going to ask the parents. Mom, Dad, do you have any knowledge of any pre-existing conditions that may impact our ability to safely restrain or isolate? Why am I asking that? Well, we need to know if there's any pre-existing medical conditions that may present a harm to the child. So if they have asthma or an underlying heart condition, we need to know that, because if we know that, we may choose not to restrain and potentially lean into isolation in an emergency situation, right? And we can do that if we have that knowledge. But I would always ask that question of Mom and Dad, are there any pre-existing conditions that may impact our ability to safely restrain or isolate, and document that into the IEP or the prior written notice, wherever you need to document that, okay? Before I hit the next slide, I just want to preempt it. Are parents entitled to a copy of a restraint and isolation report? Potentially, parents, because it is part of that educational record, parents are entitled to inspect and review. So please understand that depending on your district policies and procedures, I know last week some practitioner said, we provide a copy of every single isolation restraint report to parents as soon as we do it. We just mail it home. That will be your district's policies and procedures, but bare minimum, because the restraint isolation reports are considered to be educational records, they are entitled to inspect and review those reports. So making sure that they're accurate on the front end is going to be imperative in those cases too, but then also making sure procedurally you're notifying parents the same day, principals, okay? Notifying them the same day as the incident. When should you request a functional behavioral assessment? If you're having to restrain and isolate more than once, you need to implement an FBA. If you're having to restrain or isolate a general education student, you should probably initiate your child fine obligations to evaluate that child under 504 IDEA. But we need to ensure that we are considering the use of a functional behavioral assessment to identify those replacement behaviors. And then if necessary, implementing that crisis or safety plan if we do need to implement the crisis prevention techniques. Positive behavioral supports, we've already talked about this as I'm nearing my last 2 minutes here. These are links to get you to SEPSA in our state board rule around restraint and isolation. We would always encourage you to be well versed in what is required under SEPSA and state board rule. And any questions, again, that you have around this, we'll be happy to respond to. We really, again, are striving. One of our my goals especially is around around decreasing the use of restraint and isolation across the state. We've done a lot of work so far, but I credit that to you guys partnering with us through 1010. But we have a lot of work to do, and I certainly think we're on the right track. But a part of that is making sure that we understand what is allowable and not allowable, and then you guys helping us to help your staff implement your respective curriculums in an appropriate way. Here is our contact information. So feel free to reach out to me if you have any questions. I know we consult a lot with districts around the use of restraint and isolation. Questions, can we use this type of thing with our students? Can we use this? We're always here to help consult. And then often we may indicate to go back to your local boards of attorneys, but we certainly are here to answer questions and help to support you as you navigate restraint and isolation. So thank you, everyone, and I will stop sharing and see if we have any questions. I know I went really, really fast on that again. I'm getting to the chat box. I see, Thomas, if you can clarify your question that you say staff that are trained in CPI or PCM, let me know kind of the context of that. Can you remove a visually impaired student's cane if they are using it to cause physical harm? I don't know. Taylor, did you answer any of these before I start talking?
I didn't answer that one, April. I wanted to see what your thoughts were.
We had this come up this past week around if a student's talker, if they were using it to hit their head. And so part of this, I would say, if they're using their cane to cause harm, so hitting others or themselves, I would absolutely make sure that you have a functional behavioral assessment and a BIP to address that. And then I would work with your vision and mobility folks to talk about if there are any alternatives. I would that's a hard one too. Taylor, chime in here on that. We don't want to give them time and space to harm themselves, absolutely, but I would have some provision of temporarily removing it or providing an alternative to that behavior. So if they were hurting themselves or hurting others, but I certainly want Taylor's perspective here around that
Yeah,
question.
that's the way I was leaning to. There has to be some relief when the student is endangering themselves or others. I think this rule is intended to say we want to make sure we're controlling problematic behavior, not necessarily limiting a student's access to other parts of the school district. So, or the school building, excuse me. So, if they do need that cane to get around, I mean, obviously make sure you make wherever the student needs to be accessible to them by some other means. So as long as you have documented, we took the cane away for this reason, and here's how we provided access to the student, I think you're okay as long as you're only using that for short periods of time. So like April said, if we start to see a pattern of this, I'd be more concerned. But if it's truly just a one-off situation, I think you'd probably be okay there.
That's what I was thinking too, even just temporarily removing, and I even recommended the iPad that potentially was the talker. Maybe when they are using it as a means to hurt themselves, is to then replace it with another means of communication, maybe just using picture cards, something else that would not be and have the risk of harm, even temporarily. I see, Taylor, you answered the question about cumulative time. At one time, we were told to put restraint into the BIP since it's part of the IP. Is there a place in the IP document? Yes, Leanne, there is. So if you have an FBA BIP, so under the special consideration section, there are two questions. Does the behavior impede the learning of themselves or others? If you select yes, it's going to flag, do you have an FBA BIP? Because you have to have an FBA BIP according to state board rule if you answer yes. And then the next question says, does the student's behavior present a harm to themselves or others? And if you say yes, it's going to again say, do you have an FBA BIP in order to adhere to state board rule? And if you say that yes, the student's behavior impedes and it poses a risk of harm, of injury to themselves or others, and you have a documented FBA BIP, a third box will open, and that's where you can put the provision of use of restraint or isolation into the IEP. Often, and this is my philosophical stance, Leanne, so if you disagree, that's okay. I prefer not to put restraint and isolation into the BIP. The BIP is a vehicle for teaching the child appropriate replacement behaviors. It's not about the crisis side of things. So if you need to have a crisis plan, I prefer that that is on a separate document. That's just my philosophical position because I sometimes see it at the bottom of the BIP. And it feels like if they don't appropriately engage in the replacement behavior, it almost looks like it sanctions the use of restraint if they don't follow the BIP appropriately. And I always want to differentiate between an emergency crisis situation and following the BIP and the student actually utilizing those replacement behaviors. Now, nothing, and Taylor, I see you come, nothing requires that. So it's okay if your BIP addresses restraint isolation in the BIP. That's not a problem. It's just my philosophical approach, and I know Triad also teaches that the same, that we would prefer that the provision of restraint isolation live outside that BIP document. Go ahead, Taylor.
No, I was just going to say I completely agree. And hopefully that doesn't mean we're in an echo chamber, that just we're in alignment of thought here.
Perfect. I see, hypothetically, I love hypothetical questions. If a student is seeking oral input and puts something that will cause them to choke in their mouth and they are running a disregarding redirection, would it be a restraint to physically remove the item? I'm not a fan of putting my hands into any kid's mouth either. There's a big risk of harm to you by doing that. Um, I will say I would work with, my first thought would be to work with your occupational therapist on appropriate replacements. I've worked with a number of kids that needed that oral sensory input, and they would put inappropriate items into their mouth. And so we, worked with our occupational therapist, our BCBA, to find alternatives to that were appropriate. And I can't tell you, and I will never tell you, well, you shouldn't have restrained or isolated in that case. If you deem it and can argue in your restraint report that it constituted an emergency situation and you needed to restrain, then you needed to do that. I will always defer to you guys in terms of what that constitutes. It's very fact specific for you. And if I'm not there, then I'm not going to be able to deem that in your place. So I don't know if I'm going to necessarily be able to answer that one for you because it is so fact specific unless Taylor wants to take a shot at it. But I will always have you guys weigh the risks and the benefits, document in your restraint report why you did that, and give us the context of he put something in his mouth, it was a choking hazard, and we needed to put him into a hold. And in that case, please have an FBA BIP in place. Consult your OT, even maybe your SLP about communication, and your BCBA. I see everybody saying thank you, and I don't see any other questions, so I will give it back over to Susan to end today.
Thank you, April.
Thank you, everyone.
That was excellent, as usual. Somebody did indicate, do you have a listing of all of the acronyms? I'm assuming that they're probably spelled out in the PowerPoint, but if there's something specific that you're looking for, drop that acronym in the chat and we can answer it very quickly. But we try to at least provide the full context of the acronym early on in a slide if we do end up using acronyms later on. I think, April, you were caught up on all of the questions. Thank you, everybody, for joining us today. We so again appreciate your participation, your willingness to support students with disabilities in your school buildings. I thank all of the presenters for sharing this amazing information with everybody. We will be sure everything that has been referenced will be added to the CVent page. We will get also some things uploaded to the Special Pops YouTube channel for some of the, when these videos are posted. And then you should be receiving an email with a link to the feedback survey. And that is how your credit for tassel and your PDP points will be tracked. But if you have any questions, just reach out to anybody that shared information today on the call. We are here to support you. And thank you for everything you do every day for students. We appreciate it.